Hi, I'm Sonja Meiers, and I am a professor and director of the graduate programs in nursing at Winona State University in Winona and Rochester, Minnesota. And I'm going to be sharing a little project today that we've had ongoing for a couple years in our university with the graduate students. The title of my presentation today is Promoting Health Literacy with Immigrant and Refugee Families, Combining Education and Research in a Service Learning Project within a graduate nursing family health promotion course. So just a little bit about my background. I'm by clinical practice pediatric nurse and family nursing by evolution through pediatric nursing. I became sensitized to the needs of families, particularly through my experience in home care for medically fragile children. I also have taught nursing at the undergraduate and graduate as well as doctoral level, first at Winona State University in Mankato, Minnesota, where I was for 19 years after my first 15 years in practice, and now am at Winona State University beginning in 2009. My PhD is from the University of Minnesota, where I began to study with Patricia Tomlinson, and my dissertation topic was focused in pediatric critical care, specifically around the family nurse co-construction of meaning within the nurse-family member interaction and the kinds of things that family members learned about nurses and nurses learned about families through the interaction. My particular focus today, though, I really want to talk about what has become a new area of interest to me, and this is one of those serendipitous things that occurs when you move to a new location and you are invited to participate in the community. And my entree into the community was through Rochester Healthy Community Partnership, which is a community-based participatory research group. Began in 2004. Winona State University is a partner with Mayo Clinic, the school district, the public health department, regional health care, Olmsted Medical Center, and then a number of community-based advocacy groups for immigrants and refugees. And so they comprise our partnership. So currently my other projects are that I am a co-investigator on a funded project with Rochester Healthy Community Partnership, where we're working on developing an intervention, a family-based intervention for immigrant and refugee families of the Somali, Sudanese, Hispanic and Cambodian communities, focused on improving nutrition and physical activity, not necessarily to combat any particular problem, but really truly focused on health promotion. I'm also a principal investigator in looking at parent appraisal of pain with a group in Italy and how the nurse-family member interaction influences that. What I'm going to talk about today is a project called Let's Talk. It is Learning Together to Improve Health and Health Outcomes, a community-based health literacy project. In the community of Rochester, Minnesota, which is a very typically and historically kind of a Caucasian, Scandinavian, European community, we have, over the past 2 or 3 decades, been very welcoming for a number of reasons to immigrants and refugees. We have a large employer, which is the Mayo Clinic, and then we have a lot of kind of religious groups who are committed to assisting strangers from other communities, other countries who need a new home. So at the current time, we have about 25% of our population who are culturally diverse, many of them who are immigrants and refugees in Rochester. So the purpose of this project was to develop a health literacy program to enhance the health literacy of our immigrant and refugee groups through a participatory, community-based participatory research project with and for our community partners. We have currently, in that project and through the work of faculty at Winona State University, my co-investigator is Carol Jensen, and her graduate students working in the Advanced Health Promotion course, as well as with graduate assistants, have adapted the Florida Health Literacy Project curriculum, Staying Healthy, for use in Minnesota. And then the content of that particular curriculum is Topics of concern to health literacy, things like talking with your healthcare provider or reading medication labels, looking at food labels, gaining access to health care. And certainly there are certain common health problems. In addition to looking at the curriculum specifically, the students, along with community liaisons, who are identified leaders within those communities that I named, the Somali, Sudanese, Hispanic, and Cambodian communities, students worked with those community leaders to determine what might be the best educational methods that members of their communities, particularly in groups of family, so family, that's where the family part comes in here, is that the teaching and the work is really done primarily with families within these communities. And so through the course of about a year, the family health workers or the community liaisons and the graduate nursing students in the Advanced Health Promotion with Families course developed both the curriculum and the educational approaches. The other portion of the curricular goal for this particular project, and I'm talking a curriculum, but I also want to let you know that it's a combined research project and educational approach. So that's kind of how we can do it best in a teaching institution. We are primarily a teaching institution, so what we do needs to be really connected to our teaching scholarship, and for me that's family nursing, and that's how we can pair them together. One of the other goals is to provide graduate nursing students with the opportunity to improve their skills in communicating in linguistically and culturally appropriate ways with members of communities other than themselves, persons whom they are not familiar with. I want to also let you know these are all nurses who practice in our community, who probably practice on a daily basis with members of persons from the immigrant and refugee communities. However, the influence of this project has clearly demonstrated that they learn new things when their intention is on linguistically and culturally appropriate practices. We have, as I said, the two courses, Advanced Health Promotion for Families, which is a primarily classroom session didactic course, and then we have a connected Advanced Health Promotion for Family clinical. And within that clinical model, we use the Mancuso model of reducing health literacy barriers. And 33 students have participated in the course thus far. We use measures to determine whether what kinds of learnings the students have had. That's a health profession schools in service to the nation program survey. Asks questions like what are their attitudes towards service learning, the impact of this experience on their career, what's it like to work in a diverse community, and their experiences particularly in the course. The implications really for what the student experiences have been thus far is that students seem to be learning very clearly and appreciate the struggles of immigrant and refugee families. In family nursing, we really struggle and want our students to grapple a bit with the idea that they may not know or understand another family simply because they've come from a family. And it seems as if these graduate nursing students working with these particular families, paying attention to their health literacy challenges, really get it. This kind of experience really changes who they are as practicing nurses while they're graduate students. Students learn about their own assumptions and biases. Student abilities to enhance their effectiveness in interfacing with persons from cultures other than theirs are improved, and language barriers are seen as a significant factor. Students, in addition to completing the measures, also do kind of a reflective journal, and within that reflective journal it's very clear that they are frustrated many times that they are unable to communicate the health literacy message simply because they are unable to utilize language that the person who is receiving the message can understand. And that's particularly of importance when you're working with families and you really want desperately to help them to help promote their own health, giving the families kind of the control of that, because that's, as we know, families are the primary healthcare and healthcare providers. So it's very clear that the students understand that without great communication and health literacy, these particular families are very challenged in promoting their own health. And so I see at this point that that is the most significant outcome thus far of the project. So I thank you for sharing a little bit of time with me today, and best wishes in your own family health promotion.